everyone. This is Ankur Kalra, and I have on the show with me a very special guest today. These are unprecedented times, as all of us know. We're in the midst of the coronavirus pandemic, and I have with me Dr. Gogas, Bill Gogas. We call him Bill. He is the deputy editor of US Cardiology Review. He's currently based in China. He has actually been in China for a while. He's an interventional cardiologist at, correct me if this was the wrong pronunciation, Bill, Nanjing First Hospital, as right. I read it. And he's actually, quote unquote, an outbreak survivor. But I would say geographically a little far away from where the epicenter was in Wuhan in China. But he's an interventional cardiologist, and he has been in the thick of action in China where this has unfolded, and unfortunately has now taken the world by storm. So I'm sure the listenership and the audience want to hear more from you, Bill, than from me, as US is just starting to grapple with the pandemic situation here, in the state of Ohio, which I think it has been at the forefront of dealing with this epidemic, with Governor DeWine actually announcing closing of bars and restaurants as of 9 p.m. yesterday, which was a Sunday. So thanks again, Bill, for joining us, and we can't wait to hear more from you.
Well, Ankur, it's a great pleasure to be with you. I'm so glad I'm in your show. And indeed, the situation now, I'm following the situation in Europe and also in the US. It looks like now this has been spread out, and it's very important, to take measures, protective measures up front, in order, to have very fast results. Because if we leave this go away, if we're not very careful from the beginning, this will have devastating consequences, not only in the healthcare, but also in the whole society. And also, I'm mentioning also the financial repercussions of, this pandemic will be devastating after 2 or 3 months.
Yes. One can only fathom the consequences from an economic or a financial standpoint, but also, consequences from just the sheer number of people that have lost their lives and the families affected. To the best of my knowledge, I haven't seen anything of this magnitude in the 37 plus a few months, years of my existence.
Right. So am I. That was the first time. Yeah.
So it's for a lot of us, actually. I apologize. I touched my face there. You're not supposed to touch your face, right? That's the recommendation from the Centers for Disease Control.
Right. There are new things we will learn now. There are new things that we'll learn, and this, no one was expecting that. And we were reading books, we were watching movies, but this became reality. And I'm really impressed by what I've seen here in the place that I'm working, and I'm really impressed by how serious the whole situation was taken by the local authorities, but also how fast the local authorities moved in order to contain this virus. Of course, as you know, I'm based in a city which is about 400 kilometers away from the epicenter. And imagine this is a distance between Atlanta and North Carolina. And I have to tell you, Ankur, that now it's mid-March. And since the outbreak, of course, later on it was named as pandemic, in this city that it has 8 million people, only 93 people were infected. And out of those 93 people, all these patients were successfully treated. There was no death. This is miraculous. This is this explains the fact that how seriously all these protective measures were taken. Number one, how obedient the citizens were to follow the instructions by the local authorities, and also how the system moved so fast in order to contain, this devastating clinical entity, the coronavirus.
So thank you for bringing that up. So walk us through this, because I think the initial reports that started coming out of China, out of Wuhan, were, I think, in December of 2019. When,
right, yeah. So, to be honest, the time I was hearing the news, I was not here. I was for New Year celebrations outside East Asia. So I was hearing the news, and of course, everyone was scared. And I was scared. I was thinking, oh my God, what's going on now? When you don't have experience in certain things and you are exposed in things that you don't know, you are scared, twice or more, because you don't know how to handle the situation. It's a new situation that you have no idea how to handle. Anyway, I landed in the capital, and it was the first time that when we landed, I stayed within the aircraft for about 15 minutes because, regulators gave us papers to notify them if we have any flu-like symptoms, and also if we have previously traveled to the epicenter. I'm saying this in order to mention how seriously every step of this procedure worked like a very well-oiled machine. So 50 minutes within the aircraft, this happened to me the first time. And of course, an aircraft that has, a capacity of 250 people, we were only 65. Of course, and then in the airport, it was me and the other 64 passengers. It took me 5 minutes to go through the immigration, clearance. And then, of course, coming home, for about 35 minutes in the street, it was just me, no one else. This speaks to the fact that, when there was instruction of stay indoors, citizens stayed indoors. And this taken very seriously since the early beginning. Of course, later on, this time, at the end of this was basically at mid-January. So as you know, mid-January is the Chinese New Year. So it was the week that it was the week off. And as you know, during this time, millions of citizens are traveling. And this was completely canceled. So traveling was canceled. That was a very great protective measure in order to not disseminate and in order to stop the spread. There were many protective measures, and I was really impressed also by the care that the authorities showed to the physicians. Very protective equipment, the so-called PPE, instructions, drills, and actual handling of situations. And also there was no, in my opinion, as I saw the situation, there was no calculation of any cost of what this will cost to the local economy. So all the resources became available in order to contain this devastating pandemic. This was amazing. This was impressive to me. And I think this speaks to the fact that within 35 days, as you saw, Ankur, this started in January, and in February 16, the exponential growth of the curve sharply declined. And since February 15 until March, in March that we are now, basically there are no other cases outside the epicenter. But also within the epicenter, there are a small number of cases, maybe less than 10. So this speaks to the fact that, all the system worked very fast and very efficiently. And I think, I believe that East Asia, had a similar experience with SARS. Mm-hmm. And I think they have taken those lessons from this era, the era of the SARS. Something that, of course, in Europe, this has not been taken, very seriously. As you know, I was born in Greece, And also now Greece is in a very bad situation. Of course, Greece has very small amount of resources. It doesn't have, the economy of countries like the US or North Europe. And we think this situation is even harder, to contain a pandemic that will cost such a tremendous amount of money in the local economy, which basically, these funds do not exist. But anyway, indeed, the spike the exponential growth that was going up until mid-February, it had a sharp decline at February 10 to 15, and after this time, everything was going better and better until mid-March that we're doing now, and things, are even better. And unfortunately, of course.
So thank you for walking us through the various steps which were undertaken, at a societal level, from a policy level, and also from the execution standpoint.
Right.
By local authorities. As a cardiologist, as an interventional cardiologist, walk us through, what happened in the past 2 months, with your scheduling, with the ability to see patients in clinic, with the ability to perform procedures in the cath lab. And, like you just brought up, the issue of personal protective equipment, which is PPE, which is an abbreviation that is being thrown out in all the emails and all the tweets and also on the news. If you can just, because I think there is a lot to be learned from your experience in China, and I think is something that we're going to see here in the US very shortly, as we are on the upswing of the curve, if you may. Walk us through what happened in your practice of seeing patients, evaluating patients, canceling clinics.
I believe as a first step is important. The hospital to halt the elective cases. Elective cases. Imagine that someone comes. Let's not talk about cardiology. Let's talk about someone comes with, an abdominal pain. And he's coming with another 4 or 5 people with his family. You check him, he's corona negative, but what about his family and the people that he brings in the hospital? And of course, elective cases, in my view, should be cancelled immediately. And there should be measures to only serve the emergency situation. For example, emergency situation in our specialty is the STEMI and the dissection. Mm-hmm. I believe also, I haven't seen it here, but this is what I was proposing to some of my colleagues in Greece, that those specialties, like, dermatology, psychiatry, those words need to be converted in special words that can accommodate ventilators. So you need to increase the capacity of a healthcare facility in order to support patients who are infected for the COVID-19. All the resources should be driven toward this effort, and of course to serve some emergency situations. Now, as you know, it's important. It's important also to discriminate the healthcare facilities in facilities who can serve patients who are COVID-19 negative and those who are COVID-19 positive. So there should be hospitals that should be the hub hospitals. These hospitals can treat only patients who are coronavirus positive. So, for example, if a patient comes to the emergency, of course, you will need to first of all, you need to see if it is a situation that needs to be immediately taken care, or he needs to go, because the more you stay within the hospital, you increase your chances, if you are negative, become positive. So as long as a patient, is in an emergency situation, you have to ask some clinical questions. For example, if he had fever, if he was coughing, if he had dyspnea, shortness of breath, or if he had immediate contact with someone who was positive. Mm-hmm. These are some clinical questions. Mm-hmm. Then, as you know, Anchor, there are data that are showing that the PCR, then to detect the nucleic acid of the virus, is less sensitive than the CT scan, the chest CT scan. So, and this happens because maybe the viral load at the time that you do the test is too small. This happens also because the nasopharyngeal swab that the certified registered nurse is taking maybe is not taken very properly. And also it depends on the technology. There are different technologies. Now I hear that, there is a consistent CDC-based coronavirus testing, but I'm not sure, if other vendors also supply, the coronavirus testing. So it depends also on the technology. And it has been shown that early signs of the opacities, of the ground glass opacity that we're seeing in the lungs, which of course are not specific for the COVID-19. We can see it also in other diseases of the lung. They're showing very earlier also than the PCR. And also, as a matter of fact, the PCR takes about 3 to 6 hours. While the chest CT that can be done also with a portable CT scan, it takes 10 to 20 minutes. So there's a very, very, very big difference. And of course, as long as the patient is positive, of course, he needs to be referred to a hospital that is responsible to handle positive COVID-19 positive patients. And this hospital is equipped, has trained the staff, the physician, the nurses, how, the PPE, in order to wear the PPE is not an easy thing, but also to take out the PPE is not an easy thing. You need to be trained. And also you need to have, a cath lab room with a negative pressure. This is very important. Then you need to disinfect. There are many things, of course, that need to be taken care of. And then the patient needs to go to a CCU that also specifically for COVID-19, positive patients, and also the staff of the CCU should be also take care with specific precautions these patients. So, to summarize, we need to see only emergency cardiovascular situations like STEMI and dissections. STEMI for primaries and dissections for CT surgery. We need to divide the hospitals in hospitals that can treat COVID-19 positive patients, and also hospitals can treat COVID-19 negative patients. And also thousands now of patients, and many doctors have been infected. Some have died. The same happened also in East Asia. It's very important, to protect the nurses and the doctors who, are the first line responders. And we have, the first impact of this of the emergency.
Yes. So I think I lost you somewhere in between there, but we're back now. So just for the sake of summarizing and also repetition, because this is all new to all of us, you are recommending training for cath lab personnel and also training for intensive care unit nurses and doctors who are taking care of acute cardiac care patients with regard to using personal protective equipment, because, like you said, it requires training to put that equipment on, and then it also requires training to take that equipment off. You have to do it in a secure, safe fashion. So that's one take home. The second take home obviously is dedicating a negative pressure room for you to be able to do cases in the cath lab, because cath lab cases, typically cases that we do, either structural heart or coronary cases that we do on a day-to-day basis, are done in positive pressure rooms. They're not negative pressure rooms. I believe N95 or N100 respiratory masks for everyone.
Right. This is coming together with a PPE. Mm-hmm. Every PPE should have also N95 masks, mm-hmm. double gloves, and protective glasses. It's very, very, very important. Very important.
Okay, so those are again very important points. So the N95 masks, protective eyewear, and like you said, gowns.
Right.
And then are healthcare professionals taking any prophylaxis before getting in active contact with these patients? Because obviously we're at the front line. So was there any system-wide prophylaxis for the recommended prophylaxis for the healthcare provider for taking care of these patients?
I'm not in the position to answer this question because the hospitals, the patients that were checked and they were positive, they were going to have hospital. So in this hospital that I was employed, we treated, the primary PCIs in patients that they were confirmed negative. Mm-hmm. So, I'm not in the position to answer this question. Not sure. I guess there should be instructions for that. Yeah.
Okay. So that's good to know. But in the hospital that you're working, did you come up with negative pressure rooms at all, or were you just shipping these patients to a dedicated COVID-19 hospital where? Dedicated. Okay.
Right. Dedicated, that was a much larger capacity. I heard that the dedicated hospital had a capacity of over 1,000 beds. This is, these numbers are, these are regular numbers for East Asia. Yeah, the numbers are very different than Europe and the West, obviously. Yeah, different numbers, different populations.
So overall, has China been able to curb the mortality from this? Because
from what I'm reading, Ankur, is that outside the epicenter, for 2 consecutive weeks, there are not new cases of coronavirus. As I'm telling you, in the city that I am in Nanjing, 93 patients were detected, and those 93 patients were successfully treated. And this is, an area with a population of 8 million people. Can you imagine that? And also, now I'm hearing that cases from outside are coming. So now there's a fear that, the cases which are growing so much potentially, outside the country, unfortunately, it should be taken care of very well at the borders because, they may infiltrate again. And this is a big problem. I think this is a big problem, for every country, as long as there was containment and as long as, you see positive trends of flattening the curve, at this point, the measures should retain very strict, because you are afraid of reinfection and respread. There is, of course, these are lessons that everyone is learning. These are not written in the books. This is experience that you're gaining in such a short period of time. And to be honest, Ankur, I'm hearing about experts. This is something that we didn't know 3 months ago. This coronavirus, it was only in animals. Mm-hmm. I mean, and basically what we know now is what we're doing for every viral infection. take care of your personal hygiene, wash your hands very well, keep your distance from others. These are some basic measures, that we are following, but this must be followed very strictly, because if this is not controlled at the early time, it looks like there will not be a bend. Usually we expect a bend in 30 or 45 days. But, if this is not taken very seriously from the early beginning, since the early time, this can take more and more. And I'm listening also about the fact that, the temperature is going up. And so let's see how this will facilitate the situation, because now Europe and US, it's mid-March. I hope by the end of March and April, this rise in the temperature will help the situation to go down. But I'm telling you, Ankur, it's you need to be prepared to live for 25 or 30 days a different lifestyle. You need to be prepared, and you need to accept that for the next 25 and 30 days that your life will change. You must protect your family indoors. You must have very selective outside activity, your personal hygiene, and of course, all those protective measures that are suggested by also your local authorities. It's very important.
So were the local authorities in China very proactive when it came to like instituting lockdown, for example, closing health fitness centers or gyms or coffee shops, bars, restaurants, cinema halls?
Right. Yeah. There was, as I told you, there was not any second that this is how I'm seeing. I'm seeing that the impact that this will have in small businesses, it will be tremendous. It will, for the employees of those small businesses, will be tremendous. And of course, I heard that in the US there is such a large package that has been allocated to support those impacted businesses and this population. But I'm telling you, this must happen. Otherwise, you will not be able to contain the whole phenomenon. This must happen. This must happen. And there are many repercussions, as you see, in the stock market. There are, many companies are suffering right now. That's true.
Yeah. Any cardiovascular effects of the coronavirus infection that you saw, or
personally, I was not. I did, but I've heard from other colleagues, and also I read at the ACC.org an interview with a very prominent Chinese cardiologist from Shanghai. Mm-hmm. That and I read also some articles that maybe those patients are dying from fulminant myocarditis. But, this is not something that is an established knowledge. I think we're at the phase that we're at the learning curve. After 4 or 5 months, when all those data have been gathered and analyzed, we will precisely know what is the course of the disease and what is the actual fatality rate, which is, so far looks like is about 3%. And also we will be more precise on what is the impact in the cardiovascular system.
True, very true. Well, Bill, any closing thoughts from you? I know you've been generous in sharing all the details and the details of quarantine, and also, how to reschedule patients, take care of yourself, be used to a different way of living. Any closing remarks from you as we sign off? And I know it must be pretty late in China. So thank you for your time.
Yeah, for sure. This is something transient. This will finish in 35 days to 40 days. There will be a lot of lessons that we will learn. But my overview and my personal experience says that unless you act very fast and very aggressive, you will not see the results you anticipate fast. So if you act fast and aggressive, then you will have results in the next 35 to 40 days. Otherwise, this, will go further. And, this is not good for the society, for the whole society, for the healthcare system. It's so the faster that we act, the better to leave this behind.
Very true. Bill, thanks again for being with us, and thank you for sharing. Thank you for sharing your experience and your knowledge, and we wish that you remain safe and healthy. And
yeah, I hope also for you guys, my close friends, now that this has spread out and comes to the other continents, please take it very seriously. And I think you, as physicians, must be proactive. You also need to, you are part of the organization, and you need to advise the organization. You are the physicians, you are the frontline workers. You have responsibility to do that. And it's a team effort, and you need to follow instructions, but also you need to be proactive. The system depends on you. The system depends on you. You are, you will win this situation, but, I hope you will win with the least consequences.
Absolutely. Bill, thanks again for your time, and we wish you safety and health. Thanks again.
Thanks so much. Thank you so much, Ankar. Have a good evening.
You too. Bye-bye.